Entrepreneurs, now each of you will get a chance to grill the other two CEOs on their companies. This is where it gets good, folks. Feel free to probe their perceived weaknesses or perhaps business model strategies you might have some doubts about. So Mert, it's time we're going to start with you. I want to know, first off, what would you like to ask the Muse?
Catherine, besides comments and anecdotal evidence that show people truly get the careers of their lives through your site, what evidence do you have that demonstrates scientifically that you truly are the future of career?
I think that's a really interesting question. Obviously, we've tried to make sure we're not just going off of the user emails we get every day or the comments we get on the site to make sure we're making a real impact. There's a couple things we look at. One, as I said earlier, we reach about 1 million people a month. That's entirely organic. We started and had 20,000 people in the first month, and it's spread by word of mouth, by people telling their friends and sharing beyond that. This is a place you have to go. This is making a difference in my life. And I think the growth numbers, when you see them, when you look at the sources and the channels they're going through, demonstrate that people are really finding value. We also talk to the companies. We're working with about 130 companies across the US, from small startups to Fortune 500 companies. They're paying us pretty substantial amounts of money every month, and they're renewing again. And when we survey them and talk to them across the board, they're telling us statistics on how many applications, what those hires look like, whether those hires are more likely to stay long term, whether they're churning and things like that. And as we're building out a picture, which we ideally are using then to close more clients, we're seeing a very, very clear pattern that the hires that come through the Muse, the people that come through the Muse are actually getting what they're coming to us for.
Mert, what do you think? You buying that?
Do you have any numbers you're comfortable sharing with us in the sense that people who get a job through the Muse end up staying for longer with the company, or they're satisfied with lower salaries because they like the company so much? Do you have any specific examples that you can point to?
So we're a 14-person company. We haven't run a statistical survey like that, although believe me, I would very, very much like to. We have a survey out right now, actually, which we've gotten about 50% of the responses back. And we're definitely seeing a very clear trend, but I'd want to obviously see everything. We also have talked a little bit about, at what point do you really invest in bringing in a third party? Because we can do all the surveys we want, but again, I think people do vote with their wallets in this space. There's a lot of small competitors. You've obviously got big giants, and the fact that we're consistently able to steal budget from them again and again and again, and eyeballs on the user side, to me is pretty convincing proof that we are onto something, and we're growing it as fast as we can.
Thank you.
Mert, turn your laser-like focus to Allison. Dig in.
Absolutely. Allison, I have no doubt that the science behind rebellion photonics is sound, and the claims that you're making in the oil and gas industry are field-proof.
You're welcome to come by for a demo.
Not necessarily. I've looked at the company. It looks fantastic.
Okay.
However, given that you guys have been working on this for the past 4 years, what do you think truly has prevented you guys? What do you think has been the biggest barrier that prevented you guys from gaining significant market traction? Again, given that you've been working on this for 4 years.
No, I'm so glad you asked that. And I think what's different with our hardware company is really what separates the boys from the men. Our hardware company is true hard tech, true breakthroughs in science. We didn't just come from a business school idea. We came from deep in the labs of NIH health systems. We've had over $4 million go into the research and development of this product. And yes, I am proud to say it took us 3.5 years, and that was lightning speed. When you make true innovations in science and then carry that from proof of concept out into a full-scale operation in a refinery, just so you know, in this space, 3.5 years is blazing.
But to be honest with you, 3.5 years is how long you've been operational. The research of your CTO, your co-founder, has been going on long before that, given that he's truly a researcher and this is a university-developed research.
I am absolutely proud it took so long. It took a long time to do and so much money because true innovations take that long. It also speaks to the barriers of entry in this space. It took us a long time, and we are a physics powerhouse. It's going to take our competitors just as long. So what you're saying just says to me our runway, as I call it, where we're going to be really owning this space, is just clearly going to be at least 3 years. Where I wonder if in your company the technology innovation is as durable.
We're going to get to that question in just a moment, and the technology and the science. And Allison, take a breath with Mert for just a minute. You guys are doing good. No one's breaking it. You break a little sweat. There might be a little sweat here. I want you to turn first to Catherine and ask her toughest question you've got for the Muse.
I'm so pleased to meet another female CEO co-founder, and I love to see the videos when you pitch. I love the light that comes in your eyes when you talk about it, and you really do express a boldness that I just love, and I'm so excited to have a fellow CEO. And then I actually got down to business and actually looked at your website, and I was shocked. I was shocked that that was your website. This bold, really like a rebellious woman who I would love to get to know better, by the way. And then this was your website. There were cooking recipes and lots of nonsense. And when I see you pitch and your eyes light up, you get excited about those videos. And I can see you. I can see you. You were at Ivy League. You did everything right. You went to your fancy consulting job and you hated it. You hated it and you were daydreaming, and you're a visual person, I'm going to assume, and you wanted to see videos. So my question is, why is your website not as clean and bold as you are? Why is it not just the videos? And there are different ways to do that, and you can have an advanced search button and you could go through it, but why is it not? It looks like it was designed by a committee, and it doesn't look like it was designed by you, and I mean that as a compliment.
All right, Catherine, she's thrown down the gauntlet.
Yeah, and what's been interesting about the evolution of the Muse over the last couple of years is the ways that people have used our product that we didn't necessarily dream of in the beginning. When we first launched the company, those 20,000 users who came in the first month were primarily women in their 20s. And as word spread and as people started using different parts of the site, we started having these different demographics that were asking things and taking parts of the site and making them their own. So we have stay-at-home moms and dads who are using the site to get back into the workforce. We have vets that are getting back into a civilian career. And we also have people who have come and found us when they're not necessarily looking for a job, but they want that smart work-related content. You could call this the BuzzFeed defense. There's a reason that people like cat pictures on BuzzFeed. And for us, 95% of the traffic on the site is to job search, management, leadership-related content, but it doesn't mean that it's not fun for us. And I think for me personally, to sometimes also say, here are 11 things we wish had ended instead of Breaking Bad, or here are 5 recipes that you can take to work for lunch. That content doesn't necessarily have the appeal to every single person, but it does mean that people are coming on a daily basis, even when they're not changing jobs or they're not asking for promotion or negotiating a raise, because there's something new work-related every single day.
So Alice, that's a fair point. I mean, you want to keep people on your site, and interesting content, cat photos, whatever it might take, you might do it. What's your response?
There are great content websites where they just puke out content, and that does well, Huffington Post, but I don't think that's the kind of company you want. I think you want a mega company. I don't think you left the fancy job to do a little 1 million, or maybe 2, maybe you'll hit 10, I don't know. I don't think that's what you left for. I would think you wanted to be in the big leagues. And when you look at the websites that are really the big leagues, they are so brutally simple and addictive, and they do one thing. Mm-hmm. They do one thing, and I know you got it in you, and I would just love to see you just take a knife to your website and make it just the one thing you're selling.
Kind of the velvet hammer over here. All right, let's turn back to Mert. All right, your question for him.
Oh, okay, yes. I love your all's passion for your market. I think there needs to be some real innovation in your market, and I love that you guys took the chance. And I know how difficult it can be being a young founder, so just my hat's off to you. I mean, I know you probably have some stories to tell.
Thank you.
And I just was wondering, deep down, it's going to be nearly impossible to take GE and the inventors of Purell and their company head on in technical innovation. You know this deep down. So what I want to know, have you considered other business models where the innovation there could take you? For example, have you considered your company turning into more a service company where you're doing profit sharing with the hospitals, and then the technology risk goes down because you can use yours, you can use somebody else's, and then the adoption risk goes down, which are 2 of your biggest risks. So have you considered maybe putting down the hardware innovation and really focusing on business model innovation, where you could have a longer runway and a clearer exit strategy.
That's specifically what we're working towards with Blue Cross Blue Shield. So when people hear hand hygiene, immediately they think of Purell, they think of alcohol hand sanitizer, or they think soap and sink. What we see when we look at hand hygiene is we see hospital-acquired infections. And to date, the biggest people who get impacted financially from hospital-acquired infections is not the hospitals. They're only part of the financial victim here. The biggest victim is the Medicare, Medicaid, the private insurance companies. And our partnership with Blue Cross Blue Shield speaks to the fact that we are investigating these business models. And Blue Cross Blue Shield believes in us because they have led our investment round. So it's absolutely something within our pipeline. But the current stage of where we're at, not only we're investigating the different business models that can sustain us long time, we just want to make the case for hospitals themselves to buy the product in the first place, of which they're doing.
So you haven't narrowed down a business model yet?
Currently, the business model is working by direct sales to hospitals. Hospitals
So you're
are
doing
buying our
direct
solution.
hardware sales.
We give away our hardware for hospitals,
Okay.
and we have a yearly subscription fee to access our data. We make our money both from the software as a service,
so like
but also
GE
the
Healthcare
cartridges
and-
that we sell through our dispensers.
Okay, so like your competitors. I just think it's going to be a really interesting time with healthcare, with Obamacare, and you could do some very interesting things there, which would, I think, be very exciting.
Absolutely.
All right, don't get too cozy, guys. No smiling at each other. You're not off the hook yet because Catherine has been very patient over here. Your turn. First to swipe since your question.
Right. So, I definitely think it's interesting. I like how you mentioned that Blue Cross Blue Shield is both a customer and ledger investment round. We actually have a number of our customers that have come and asked and now are investing as well.
Congrats.
CEOs of the companies that we work with, which is always a great thing. So my question for you, really, I want to dig in more to how your product really differs from your competitors and whether it actually is solving, for example, the transmission of MRSA. Because from what I've seen so far, at least, it seems like the 100,000 deaths a year are primarily caused by things that so far your product isn't necessarily able to make a big dent in.
There are a number of questions in what you prevailed. The first one is, what percentage of infections are prevented by alcohol hand sanitizer? According to the CDC and the report that was released in 2002, alcohol-based hand sanitizer is the gold standard in hand hygiene, and it prevents 99.9% of the infections that occur in hospitals. The infections that alcohol-based hand sanitizers don't prevent is actually not MRSA, it's C. diff, Clostridium difficile, which is a spore-based infection. Now, those spore-based infections are prevented by use of soap and sink, which our technology also has the ability to track. So, in terms of our ability to prevent infections, hand hygiene is the link between hand hygiene and infections have been set for decades, and it's there to stay. Now, in terms of how we're differentiated from our competitors, SwipeSense is the only hand hygiene monitoring system that only takes a snapshot and develops trends of hand hygiene behavior, but also empowers healthcare workers with a tool to do hand hygiene on the go. So it's not just we report you're doing not so good today, we actually give them the tool to make the right choice the easiest thing to do. And we're the only company that can do that.
It just seems funny for me that, you've got doctors who are some of obviously the most educated people in America, and you're talking about empowering them to make the right choice, which is hand sanitizer, and that's great. I think that it is obviously anything is valuable, which is encouraging doctors to use Purell or your product or wash their hands more. But I guess I'm not seeing the kind of massive shift here that that we would look for in a company that's going to really change the face of healthcare.
The average hand hygiene compliance in the United States today is 40%. Now, we can look at this and say this is an education problem, or doctors really know that this is a problem. I can assure you that every single healthcare worker who's thoroughly trained in a hospital knows that hand hygiene is absolutely crucial, and they have to do it. But they have to do this 100, 150 times a day. So it's something that's very, very easy in the thick of things to just simply skip. When you're right by a patient's side and when you're changing the IV line, it's very difficult to stop what you're doing, go all the way outside, perform hand hygiene, and come back. And SwipeSense is the tool that allows them to do it right then and there. It makes hand hygiene a habit rather than a task that they have to accomplish.
Mark, let me jump in here because you're saying doing it right there, but one thing we've heard around the newsroom here, people are questioning the size of the device and how many doctors, one, how do you make doctors do anything in a hospital? And two, isn't something as big as a mouse weighing you down when you've already got other things on your chest just a nuisance to them in itself?
The SwipeSense device is weigh around an ounce. And from the get-go, you're absolutely right. Real estate on a healthcare worker is extremely valuable property. It's extremely difficult to get someone to say, hey, you should use this on top of every single 50 things that you have to carry around. The stethoscope, the pen and paper, the gloves, everything, the whole shebang. However, the volunteer adoption rate in our current installations is about 70%. People choose to use SwipeSense because it simply saves those 4 to 5 steps per patient visit. And in a busy doctor's day, that can mean minutes, that adds up to hours over the course of weeks.
Do you think you can get the device smaller? Do you think you can get the size of it down?
This was a big design question in our early development phase, and what we've decided on was basically a difference of this. If we make the device bigger, they have to recharge it less, they have to carry, they can carry more gel around them. However, we have a lower adoption rate because it's a bigger device. If you make it smaller, you get the inconvenience of having to replace cartridges all the time. And we basically settled on a number that we have found that an average nurse goes through in a day, and that's 40 milliliters.
All right.
But are you the only people that can make this device?
The smart portable dispenser, absolutely yes.
For how long?
For 17 years, because we have our patent applications in.
We both heavy sigh you.
There's some heavy sighing going on there. All right, Allison, we can't let you off the hook altogether. Catherine, you've got a question for her, I'm sure, teed up.
Exactly. I think that my question is actually along some of the same themes. I think that you were talking earlier about the time it took to develop this technology, the fact that it's it's very, very unique and groundbreaking in the oil and gas market. But you're talking about a market with obviously some pretty entrenched players, and you mentioned earlier this sort of 3.5 year lead time towards anyone else developing something similar. And my question is really, ultimately in this industry, how big can this actually get? And if it's going to, as you start to raise money, what's to stop some of these other players for saying, great, you can own the market for 3.5 years, and then I'm going to come in and take it from you?
Ooh, you talk very fast.
Always.
Let me see. So you had questions about market size. You had questions about our runway, I think, before other competitors get in this space, especially once they see the big market size. I'll just do you get 2. So market size. Let's see, there's over 10,000 petrochemical sites in the United States alone. They'll need anywhere from 1 to 50 cameras depending on the size. You can get little pipelines that just need 1, or you can get mega villages like the Exxon Baytown refinery. We're going to need 50. So you do that market size. It's bigger than I can do in this lifetime. We will not run out of market size while I walk this earth. Now, as far as technology runway, I kind of got lucky because he set me up earlier with that. So there's how much money it takes. Optics is a very specialized field. But I think another thing we've tried to encompass ourselves in is how we picked our business model. You can't really just sell hardware because what are they going to do with hyperspectral data? So then you have to do software. And then actually it formed into an IT system where we're really giving our rigs and refineries a new operational tool, a new form of information. And so when we install, we set up our IT systems, there are really high switching costs once you're installed at rigs and refineries. So the first 3 years is pure tech, keeping us safe, maybe longer. And then beyond that, the high switching costs. Now, we are taking this seriously, though, and that is why I'm doing a very large round right now, a $10 million fundraising round. And that's why I want to make the absolute most of these next 3 years. And I'm also hoping we win Startup of the Year, which will really help with marketing.
Catherine, any follow-up from that?
I just think, a $10 million round is great, and it's very impressive for a startup. But I still think when you look at, the fact that there is this technology that has I guess my fear for you is that as larger players in this space see what you've done, that you'll lose that first mover advantage, and that $10 million won't necessarily be enough to make the difference.
Yeah, I think, when the Honeywell and Halliburton look at us, they see how large and profitable the market is. Without a doubt, they will want a piece. I think they will try for 6 months to the year, and then I think they will call me with an excellent acquisition offer.
All right, guys, good questions, all of you. Some tough questions. All right, it's out. Back to you guys. Which of our CEOs is making the most compelling arguments, and Will the entrepreneur's answers bring them one step closer to being the first WSJ Startup of the Year? We want to know what you think by submitting your votes for the CEO you think is representing him or herself best at WSJ.com/SOTY. Now, there is one more part of the debate left where Catherine, Allison, and Mert are going to have the chance to give their closing statements to prove to the WSJ editors why their company should be Startup of the Year. So be sure to vote. WSJ.com/SOTY.